Last piece of this sort of backgroundish stuff is to compare us versus Canada. So that's important because when you talk about a system that's similar to Canada's, oftentimes people will say, well, Canada. I mean, it's bigger. It's got rivers. It's not got the genetic diversity that we have, which I think is a code word for saying for something more racist that they would want to say. I don't know. They say all kinds of crazy things to explain why we can't really compare the United States with Canada. Well, can we? If you look back to 1971, we were the same, actually. Our healthcare costs were the same percentage of our GDP and on the same trends as Canadians. And our life expectancies were within a few months of each other. And then, in 1973, President Nixon signed into law the HMO Act, supposedly to reduce the cost of healthcare. And in 1971, as it turns out, is the year that Canada fully implemented their Medicare program across the country. They call it Medicare. We took that word from them. So they fully implemented Medicare. So in other words, we were the same, and then we made national policy decisions that were at odds with each other. We chose managed care. We created managed care, and they chose Medicare for all. So what happened? How did that work out? Here's our healthcare cost. It's a percentage of GDP, the relentless climb up to 19% now. And then there's the HMO Act to lower the cost of healthcare. Hard to see. And then here's Canada's data. Here's Canada's data. So we were the same, following the same curve, and as soon as these policy decisions forked in the road, the curves changed, and now they spend half of what we spend. And life expectancy, this data only goes back to 1979, and I apologize for that, but in 1979, they were already living 1 year longer than we were, and now they live 3 years longer than we do. They live 3 years longer than we do. So they spend half of what we spend, they live 3 years longer, and it's all happened since the policy decision was made. So